Hello, hello. Welcome back, everyone. Welcome back to the podcast. Holy smokes. We have come to the end of March. Can you believe this month has gone by really, really fast? It is amazing. My kids are on spring break, and yeah, it is like crazy because summer is like right around the corner. So I'm getting my body summer ready as far as, my fitness and everything. I know I started this fitness journey last year around this time. And because I was very unhappy with, mentally, my mental state and just unhappy with myself in general. I was going through a lot and it was just a constant struggle with, anxiety, depression, and things like that, which I know can really it does a number on you, really. So I made sure that I started my fitness journey and, because we have wellness programs, at work, took advantage of it, got $500 out of it. So those things are worth it. So if you have those, at the hospitals or clinics that you work at, make sure you guys use that. Okay. And get yourself summer ready. Now, if you guys need help with that, I have a awesome coach. He is my boyfriend. So he will get you summer ready. He has an awesome personalized that he will tailor to your needs and meet you where you're at. He will give you dietary, nutritional advice, and he will build a program specifically for your needs. If you're interested in that, make sure that you fill out the form in the show notes and it will have all of his socials and everything like that. So you can send him a DM if you have any questions. So we can get you on board and get you summer ready. Okay. He will get you in the best shape of your life and get you summer ready. I know that when we started dating, I had done this fitness journey before we had started dating, and he has tweaked my form, and I have gotten a lot of good results. So make sure you check him out. If you haven't subscribed to the CT Educator YouTube channel, make sure you subscribe to that. I put a lot of good, awesome resources every Friday or the end of the week. Every Thursday, Friday, I do a live Q&A where I do Tech Tip Fridays and I answer all your questions, your DMs, all things CT Tech related. So make sure you check that out. Plus, I have an awesome masterclass that I taught a while back. Make sure you check that out, okay? Also, live event is this week. Make sure you sign up for the live event. Link is in the show notes. Do not hesitate. Get your ass in there, okay? So everything I've talked about, make sure that you go ahead and check out the show notes, sign up for all the things. If you're interested in my coaching program, it's 6 months. You get inside my container. I do a live class every single week, and we will coach on all the CT things, and I will get you ready to go to be the go-to CT tech and get your registry ready. Okay, all fucking good shit. So get your ass in that program, and let's go. Okay. In today's episode, I'm going to be talking about reading CT protocols like a pro and with ease, because we all know that CT protocols are the backbone of computed tomography. However, when you are a new technologist and you have never ever seen a CT protocol ever in your life and you don't understand them, it can be very confusing and they can be very hard to interpret and read. I'm going to make this as simple as I can. I'm going to give you a few steps on how to interpret them, and I'm going to give you a few pointers so that you can understand what the hell is going on. So, there is a difference between knowing a protocol and really understanding them. Okay. So, what I mean by knowing a protocol is you see it in the protocol book. Okay, so that's the CT of the head. Okay, that's the scout for the CT of the head. But understanding why and understanding the protocol as a whole. Okay, understanding it is, okay, so we do an axial because we need that high definition, and that high quality scan. Okay. We angle because we want to minimize streak artifact and we want to minimize dose to the lenses of the eyes, right? We also need to understand that there are reformats. We have to do axials. We have to do, so it's, the brain window, the bone, in coronal and sagittal reformats. On pediatric patients, we need to understand we need to do a 3D of the head because that is required, right? So those are the things that you need to understand as far as, okay, yeah, that's a CT of the head. That's the protocol I'm going to use. But you also have to understand all the other pieces to it on why we do it. Okay. And how to make sure that you understand, okay, these are the principles this is why we angle. This is why we do an axial scan. This is why we do reformats, right? So that is the difference between knowing a protocol and understanding it, because you have to understand how that protocol works. Okay. Looking at it in the protocol book ain't going to be enough. Looking at the scanner isn't going to be enough. It's when you're in it, you're doing it on a live patient and you understand, okay, this is why we have to angle. This is why we do an axial. This is why we do a helical if they're moving around all over the place. This is why we use a head holder, because it improves your image quality and you can minimize having the patient get out of the field of view. Okay. Because the head protocol is a small field of view because you want all that nice detail, right? So, the second thing that I'm going to talk about is what to do when a hospital protocol differs from what you have learned while you were training. This tends to happen a lot if you move around jobs where the hospital has a protocol for one thing, and I'm going to give you a very good example, and it differs from what you learned. So here's a perfect example. At the current hospital I worked at, when I started there 6 years ago, on their PE studies, they do oblique MIPS, so a right and a left. Okay. How I learned how to doing my PE studies, how I've always learned how to do them is that they do a sagittal coronal MIP. That's it. Okay, so we do like a regular sagittal coronal and then a sagittal coronal MIP. There have been other places I've worked at where they just want just a coronal MIP and that's it. Okay. When they said, oh, you have to do obliques, and I go, obliques? I go, they want that? Okay. Or they said, hey, you have to send the thin data sets. And I'm like, well, isn't a 2 millimeter enough for them? Nope. They want, the 625s. Okay. So those are some of the examples of how protocols can differ, especially if you learned it one specific way versus how other facilities require certain things. I don't know why the fuck radiologists want to read all those images, but to each their own, right? Now, the other thing, another principle that I am going to provide for you is how to interpret and adapt protocols without making mistakes. So, how do we do this? So, what I always like to teach my technologists is to look at the protocol as a whole. Like when we're inside that protocol, when we're about to scan the patient, like after we do the scout, we're looking at everything, saying, okay, these are the reformats. So this is your actual scan from here to here. Okay. And then here's recon, recon number 2. Okay. So here's a lung window. Recon number 3 is, okay, this is a thin data set so we can make sagittal coronals out of. And then if there's any bone recons or anything else that needs to be added. So you usually have a set of recons already built into your protocol. Okay. So I always make them click through each one so they understand, okay, this is what's going to happen, because once we scan, when it post process, this is everything that you're going to get. And then when we go ahead and perform the sagittal coronals, like that is after the fact, okay, this is where we're going to do this. This is the incrementation. This is from where to where you want to go. So you understand and how to adapt and interpret those protocols without making a mistake. So I take them step by step in making sure that they understand how each recon is interpreted in that protocol and making sure what they need to know and what to look for. Okay. So here's a little story that I'm going to share before we end this episode. Is I had a technologist that I was training. This was at another hospital that I was at, and struggled with protocols. Okay. So I said, okay, what is the biggest thing that you're struggling with as far as protocols? And they said, okay, well, all these reformats, like I don't understand them. I said, okay. So when it comes to reformats, the reason that we do that is because there's different tissue windows. So let's say, for example, with a chest CT, you have your soft tissue because they're looking for, a clot. And then radiologists like to look at lung windows because if there is any blockage when it comes to the bronchi, or if the patient has a collapsed lung, or if they got pneumonia or something like that, that window is going to visualize everything that they need to know versus the soft tissue. Okay. And he couldn't understand as far as, okay, why do we do this? And nobody showed me that? Okay. Well, this is why we do sagittal coronals, because radiologists like to see, the entire chest and see where everything is to see if there's any abnormalities. Okay. And sometimes when you look at things in a different view, if there's something that doesn't stand out on an axial image or on a coronal image, sometimes it'll stand out on a sagittal image. Okay. His biggest hangup is the difference between a regular chest CT and a PE study. And I said, okay, the difference is the incrementation. Okay. Now, when we're looking for a PE study, we have to have that thin slice, because sometimes if it's a very, very small PE, if you have that 1 to 2 millimeter slice scan in that incrementation, that's how you're going to see it. Versus a chest CT, they're normally looking for some type of pneumonia, maybe a mass, maybe something that's abnormal, something that doesn't require a PE study or an arterial injection. They're looking more of a venous phase as far as the chest. So there we have like a thicker, incrementation where they're done at 5s, so we can run through the anatomy. So his hangup is he was struggling on the difference between the two. Okay. And I said, and those are the differences because one, we do arterial phase. The other one is more of a venous phase. So typically on a chest, it depends on what facility you work at. I mean, a lot of them do like a 35 to like a 55-second delay. It just depends on where they're at. That's kind of general because I've seen it all done in different places. So that really helped him, and it really improved on how he executed his protocols and how to make sure that he reads them correctly and why this incrementation is the way it is. So that is it for today's episode. I hope it was insightful. I try to give you guys my best knowledge and my best tips when it comes to CT, and that is just what I continue to do. So make sure you guys follow me on social. I am on TikTok and Instagram. Send me an email. Everything will be linked in the show notes. Get your asses into the live event. Make sure you sign up for that and make sure you subscribe to the YouTube channel. Also, if you need to be on your best game as far as your fitness and you need an excellent online coach, make sure you check out my boyfriend. He is awesome. There will be a form to fill out. So make sure you sign up and you can DM him with any questions that you may have. So sign up for his program that is tailored specific for your needs. So as always, thank you so much for listening to this episode, and I will chat with you guys in the next episode.